BBC 3 Radio.
Okay, let's move on to our next story for you. Are you a snorer? Or maybe your partner keeps you awake with their snoring. Now, often it's not taken very seriously, but snoring can be a clear sign of a serious condition that seriously impacts physical and mental well-being. Now, obstructive sleep apnea, or OSA, is a condition where sufferers stop breathing, and it affects 1.5 million of us. On the line now is sleep expert Professor Bhik Kotecha, who is a consultant ear, nose and throat surgeon, and OSA sufferer, Mike Bulow. So let's start with you, Professor. Good morning to you.
Good morning.
Thanks for joining us. What actually is OSA then?
So OSA is a sleep-related breathing disorders which affects patients who have obstruction of the upper airway. Classically, these patients will have a turbulent airflow and will snore, and they have breath-holding episodes during their sleep. As a result, their sleep is very unrefreshing. They wake up feeling unrefreshed and tired. And of course, the scientific impact is that they have oxygen deprivation in their sleep.
And what can lead to someone developing OSA? Is it a weight issue?
Yes, so obviously if there's any anatomical factors in the upper airway that will obstruct the airway, that will lead to it, but the obesity is one of the greatest trigger factor that will exacerbate this condition.
And how serious can it get?
Oh, if left untreated, if you have moderate or severe sleep apnea and you leave it untreated, it has an impact on your health in a big way. So you can develop things like ischemic heart disease, high blood pressure, cardiac arrhythmias, type 2 diabetes, stroke, dementia, cognitive dysfunction. A lot of problems can occur if you leave it untreated.
Goodness gracious me. Let me put into the conversation Mick. Good morning to you, Mick.
How you doing, Andy?
I'm fine and dandy. Thanks for joining us this morning. So how has OSA impacted on your day-to-day life then?
Interesting. From a day-to-day impact, it was mainly sort of the snoring that was the biggest thing. My wife would complain about how noisy my snoring was. And through the night, she actually thought I was dead as I'd stopped breathing. I wouldn't just stop breathing once. I'd actually stop breathing multiple times an hour for about 15 to 20 seconds. So it would also affect me in terms of I'd wake up several times a night. I wouldn't be able to get back to sleep for ages. During the day, I'd have difficulty concentrating for long periods of time. And I'd also fall asleep at strange places, you know. So I've literally fallen asleep, for example, standing up in the front row at a gig. I've also fallen asleep at dinner parties and, you know, just in normal conversation with people, which obviously has an effect in terms of your social interactions with people. You know, when I go away to maybe festivals with people no one wanted to share a room with me. And, you know, my snoring was like I say, one of the biggest things. And my wife been scared to death that I'd obviously passed on to another world when the breathing stopped.
Goodness gracious. I mean, like you said, stressful for you while you're in bed, but also for your wife who thinks that you've stopped breathing, I presume starts punching you when that happens.
Not quite like that. In fact, she actually let me just carry on. I don't know whether there's a motive in that.
Oh, my goodness.
Yeah, I mean, it was, you know, like I say, it was more scary, I think, for my wife. And she suggested, obviously, that I went and got it sorted out.
How long before you realised then that something was wrong? Did it take your wife to say, listen, you've got to get this sorted?
Yeah, I think it was the snoring more than anything. And until I met the professor, I actually had no idea that I had this obstructive sleep apnea. And it was the results of a sleep study which he conducted, which identified that I had it. And it was through the professor that I was introduced to eXciteOSA. And the devices that I could use. But
back to you, Professor. I was going to ask you, what treatments are available then for someone like Mick who suffers with this?
So, I mean, we start off with lifestyle changes, losing weight, cutting down on alcohol. And then there are appliances. A variety of appliances are available, but There's issues with most appliances, such as nasal CPAP. This is continuous positive airway pressure, which involves a mask and a generator or a mandibular device. And what Mick was talking about is a very new approach to treatment for sleep apnea. It's a neuromuscular stimulation device that you use during wakefulness and not during sleep. The EXciteOSA has this advantage that you do not have to use it during sleep, so you just use it for 20 minutes, and it stimulates your tongue muscles and strengthens the tongue so it doesn't drop back on your airway and occlude your airway. Of course, there's surgical intervention as well, but surgery is not always guaranteed and not always suitable for everybody.
And how are things with you now, Mick?
They're a lot better. I mean, it's something that I do on a daily basis. It's 20 minutes. It's really easy to use. I've lost weight. I increased my exercise. And I've noticed the positive effects, over the time that I've been using it, which is now about 18 months.
Do you know what we've been talking there? Something similar has happened to me, where I've been sleeping and all of a sudden I've just stopped breathing, and it kind of it wakes yourself up. Does that make sense? And you go like, what was that all about? And then it takes a while to get back to sleep, and like you said, you're exhausted for the rest of the day, aren't you?
Exactly, yeah. It's periods of sort of concentration as well, and like I say, more embarrassingly was falling asleep, in public places without a word of warning.
Standing up at a gig, mate. I mean, or at dinner parties as well, even worse. You and me. Yeah. Professor, where can our listeners go then for more information about this?
Well, I think the EXciteOSA is a novel device, and if anybody's interested, they can go to the website. It's eXciteOSA.com. That's eXciteOSA.com, and it's a device that is very useful for patients who have simple snoring or mild obstructive sleep apnea, and it is used during daytime, so 20 minutes during daytime, and if you use it for 6 weeks, it stimulates the tongue. It's basically like taking your tongue to the gym and training it, and it tones the muscles of the tongue and improves the upper airway during sleep.
Amazing. Gentlemen, thank you so much for sharing with our listeners and myself as well. Thank you very much indeed.
My pleasure.
Thank you.
Cheers. That was Professor Bhik Kotecha, who is a consultant on ear, nose and throat surgery and OSA sufferer, Mike Bulow there. While having that chat, I'm going, yeah, well, that's happened to me. That has happened to me. I've talked about it on this show, haven't I? Interesting. That really found that fascinating conversation. Let's find out what's happening out there on the trains and the roads this morning. What have you got for me, please, Danny boy?